was walking through the removable department the other day and saw some restorations, some partials that I hadn't seen before, and it was kind of interesting. So I stopped and took a look at it and had one of the technicians show me a new material that we have here at the laboratory. This is called Reflex. This is a material that I think we're the only lab that is producing these Reflex type partials, and it's interesting because there's finally a competitor to Valplast, and a lot of dentists really like the idea of a flexible partial, something that's going to be a little easier for a patient to wear, maybe a little easier to make, to fabricate than a typical cast partial. And so as you look at this, the first thing that you'll notice is the clasps, of course, are all the same gingival color. It's a little easier to see when I take it off of here. And so the clasps are that same kind of color. In fact, they almost get a little bit translucent because they're a little bit thinner. And you can see that because of the strength of this material, that the entire palate does not even need to be covered. And you'll see that a little bit more as some of the other restorations that we look at, but you can see that we're not covering the entire palate, just about the anterior third. And one of the other interesting features is what this does when it's placed into warm water. So I'm going to drop this in here real quick. It might be a little more than warm in case you hear me scream in just a minute when I pick it up. Some other advantages is that there's no methyl methacrylate in this material, so it's non-allergenic. And unlike some of the nylon-based flexible partials like Valplast, this one, the Reflex, can actually be relined. And so if you need to do a reline, you can go ahead and do the reline impression in your office. You would send it back to us here at the lab, and then we would go ahead and reline it for you. And it can be repaired as well if something happens and the patient breaks part of it off. That actually is pretty hot, so I'm just going to take this out with the forceps. And you'll see how all of a sudden it becomes completely flexible. I mean, I can't think of another material we have that's quite this flexible for a partial like this. And you can see basically it waves back and forth, and so there's lots of different ways where you can actually bend this and then take it into the patient's mouth, while it's still soft if you want to, be able to seat it a little bit more and have it adapt itself to the patient's tissue. So that's one of the neat things, is that in that medium hot water, I would say, to hot water, you'll know what you're able to grab onto, and you can hear it click as it snaps down. So the more interproximal undercuts we have, the better that something like this is going to work. And so we have the 6 natural teeth here, and then we have our clasp, our gingival colored clasp on the 2 cuspids, and then it clasps both of the molars as well. And so if something were to get bent, or even before you deliver it to the patient the first time, softening it up in the water first and dropping it into their mouth and letting those clasps really adapt to the undercuts in those teeth is a nice way to do it. So besides just something like this, we could also do a modification where we've got the same type of thing, but maybe we have somebody who, I don't know, likes the feel of the open palate because they had it on a previous denture, so you can do that. So the 2 choices really are cover the anterior third, or you can do a palatal strap and leave the inside open if you prefer that. And if I think it was me, I would probably go with something like that design and stay on the anterior third. And those are pretty traditional, but we're able to start doing more things with this that we haven't been able to do with other flexible partials, and that includes like a single tooth Nesbit like this, where we've just got that 1 tooth there, and we've got again the 2 gingival clasps on the facial, and actually there's a couple little rest preps on the back of those 2 teeth just to keep it from overseating into the tissue. And that's a really nice way to be able to do that without having to cover the whole palatal tissue. Typically on a regular flipper, obviously, we're going to have acrylic across the entire palate. And so this is a nice conservative way. You have to decide how nervous you are about the patient swallowing or inhaling that restoration. But most of the time, it's the patients who are kind of asking us for the Nesbit. I'm just missing 1 tooth. Why do I need this whole other part of the appliance that goes all over my mouth? And this is another interesting one here with this cuspid, this missing cuspid. So it's here, and again, you can see we've got a clasp on the distal of the first bi. And again, all we need to do is engage just a little bit of the interproximal undercut here between the central and the lateral, and then wrap around the lingual of that first bicuspid. And that's a pretty elegant way. Maybe we just placed an implant here that we're waiting for it to integrate, Or maybe we just placed a bone graft and we're waiting for that. Or maybe the patient can't afford the implant now but might be able to do it in a couple of years. What a neat little way to replace that single tooth as opposed to maybe, you know, a Maryland bridge which could debond and fall out. And because this was put into an extraction site, it almost looks like an ovate ponic. So you could, of course, create an ovate ponic site on your own and then make something like that partial to go in there, or even these teeth over on this side. A patient who can't afford a bridge yet in that area or might not be able to afford it at all. What a nice little way to be able to go in, and you can see the full wrap around on that distal molar. Almost comes into the aesthetic zone, but not quite. Not that that's, you know, going to be in the aesthetic zone on a second molar, unless it's Julia Roberts, perhaps. I'd have to go look at some pictures of her, but I recall seeing her second molars last time she smiled as well. But you can see a minimal amount of material over here on the lingual as well. Again, just engaging a couple undercuts between the cuspid to lateral and the central, and so we end up with a really nice result here in a really easy way, and again, a way where we can drop it into some hot water and then put it into the patient's mouth and let it adapt itself to the patient's tissues. So interestingly enough, it's actually a modified composite resin. It's not a nylon-based material, but it is thermoactive, so when you drop it into the water, we're able to bend it and move things around. It comes in a couple different shades, although the pink that you see here is certainly the universal shade and seems to match almost everybody. It can be used with a metal partial framework if you still like the idea of the strength of the metal and you want to enhance the aesthetics a little bit with this material. You can definitely do that. And so as you've seen, almost any design will work, whether it's a horseshoe, a palatal strap, unilaterals. You can do full palates with it if you want to, or if the patient doesn't care. So again, this is the Reflex material. It's just being added onto our RX forms right now. So you may not see it if you see this today and go to order one of these tomorrow, but you can just write Reflex, R-E-F-L-E-X, not to be confused with reflux. And our removable partial department will know what you're talking about. So Reflex looks to be a great new way, a great new flexible partial for people who don't want the weight and expense perhaps of a conventional partial, and they want a more aesthetic solution where we can hide the clasps a little bit more because they're not only gingiva colored, but in the case of a tooth replacement like this, by engaging enough of the lingual undercuts and wrapping around a tooth, we can avoid any kind of facial clasp on the lateral incisor.